when you have gone to a doctor, when you have fallen sick any time, or you must have noticed in any of your relatives' prescription that the doctors have written the prescription order in abbreviation form. You may wonder why the doctors write in abbreviation form, and why don't they write in a simple long sentences easy for the patients to read and understand and comply with the prescription order. These abbreviation forms are being used because doctor is a very busy professional, either in outpatient department or in the inpatient department, in the wards, or in any of the treating center in the hospital or in any healthcare facility. So to save time, these abbreviations are written in the prescription for faster and quicker service to be delivered to the patients, those who are in need. Hello, welcome to Dr. Akinclicks, and I am Dr. Akin. Today I am going to share with you how to read a prescription of the doctor. So to know the details, please be with me till the end of this video. First of all, let us begin with what is a valid prescription. A valid prescription is one which has the name, the address, details of the clinic or the hospital or the healthcare facility. Then on the top, either on the left or right, there should be the name of the treating doctor, and if possible, qualification and registration number of the medical doctors should be inscribed in that prescription slip. And then there should be the name, age, sex, address, and the date of treating the patient should be clearly visible there. And at the end of the prescription, in the bottom, either it can be left or right side of the prescription, the signature of the doctor, the signature of the treating doctor should be clearly visible. This is a valid prescription. So now let's go through the abbreviation, what is mentioned or written in the prescription slip by the treating doctor. So let's begin now, and so please listen carefully to understand the abbreviation and what does it mean. These abbreviations have originated from the Latin language. I am not going to tell here what does it mean in Latin language, but I am only going to tell you what are these abbreviations which the doctors use in prescription slip, and what is the English meaning of these abbreviations. So be with me till the end of this video and listen carefully to know and to enrich yourself to read a prescription of the doctor. And in case when you get a prescription, from now on you will be able to understand and go through the medicines and take accordingly as directed. So come with me. First of all, when you see a prescription, apart from what I have already mentioned, the top left you will see RX. What does RX mean? RX means the doctor is telling you, you shall take, or thou shall take, or also it means you shall take the following medicine as prescribed. In the prescription you will find OD. OD means once a day. BD or BID or BDS, that means twice a day. TDS or TID means 3 times a day. You have to take the prescribed medicine 3 times a day. You would have also noticed HS. HS means at bedtime. That is, you have to take that prescribed medicine at bedtime or before going to bed. Then comes AC. AC means before meals or before food you have to take that medicine. The next is PC. PC means after food. After food you have to take that prescribed medicine. Then you will also notice that there is PRN or sometimes SOS. That means as needed. As and when needed you have to take this medicine. Say you are given a prescription in which it is mentioned PRN or SOS. That means you need not take this medicine regularly. You have to take this whenever you feel that symptom or whenever you feel that problem, you can take this medicine. You would have also noticed STAT, S-T-A-T. STAT means immediately or now. Immediately or now you take this medicine. Then there is Q. Q means every. If a doctor wants you to take a medicine every 4 hourly, they will write Q4H. If a doctor wants you to take a medicine every 8 hourly, the doctor will prescribe Q8H. And when a doctor wants you to take a medicine every 12 hourly, the doctor will write as Q12H. Then now let's go to the route of administration of medicines. You will see IM. IM, these are injections. Injection has to be given intramuscularly or through the intramuscular route. Then the doctor writes injection IM, injection to be given through intramuscular route. Then IV means intravenous, SC means subcutaneous, ID means intradermal. These are usually these are injections, and the doctor is clearly mentioning that this injection is to be given intramuscularly, this injection is to be given subcutaneously, this injection is to be given intravenously, and this injection is to be given intradermally. And you will also notice PR. PR means per rectum. That means this drug or this medicine is to be given through the rectum, Then you would also have noticed doctors write TAB. Tab means tablet. CAP, cap means capsule. SYR, that means syrup. SUSP means suspension, and INJ means injection. That means that these are the forms of medicine. Forms of medicine, or these are the types of medicines which the patient has to take. It can be a tablet form, it can be in the form of capsule, it can be in the form of syrup, suspension, or the drug can be in the form of injection. Now let's go through this prescription. You can see here at the top left it is written RX. RX number 1 is tablet azithromycin 500 milligram OD 5 days PC. That means tablet azithromycin 500 milligram is to be taken once a day for 5 days after food. Number 2 is tablet pentoporti BD into 10 days AC. This means tablet pantoprazole 40 milligram is to be taken BD. BD means 2 times in a day for 10 days and AC means before food or before meals. Number 3 is tablet paracetamol 500 milligram PRN. So tablet paracetamol 500 milligram is to be taken as and when needed. Number 4 is tablet levocetirizine HS into 5 days. This means tablet levocetirizine 10 milligram is to be taken at bedtime. HS means at bedtime for 5 days. The next is number 5 INJ paracetamol 150 milligram IM stat. This means injection paracetamol 150 milligram is to be given now. Stat, immediately it is to be given through intramuscular route IM. So now I have given this example of this prescription to you. So you must have known a bit of how the prescription of a doctor is written, and I hope you have understood what these abbreviations mean. You go through this video again and again and you write down these abbreviations and the meaning of these abbreviations in your diary. This will be very useful to you, and anytime when you see a prescription, you can go through what is written in your diary which you have recorded from this video, and you try to correlate what the person who has dispensed this medicine at the counter has told you. And once or twice you try this, and I am sure you can easily read the doctor prescription hereafter, and you can easily follow the instruction, and you can comply with the medicine that is prescribed to you, and that will be very easy for you and to your friends and for your relatives. So please write down these abbreviation and the meaning in your diary and keep it, and whenever you get a prescription, please go through it, and it will make a lot easy for you and your friends and your relatives. So let me know in the comment section how this abbreviation form of doctor prescription I have enlisted to you have been useful to you or not. So to get latest regular updates, please like, subscribe